Do you struggle with finding a pacifier that your baby will take? And do they even need to take a pacifier? We'll talk about that today. My name is Joan Comrie. I'm a speech pathologist who specializes in feeding and swallowing disorders in infants and children. As you well know, pacifiers are a hot topic and they're very controversial. Just ask your mom. She will give you her opinion of pacifiers. Your friends will give you their opinions of pacifiers. There's a lot of very strong opinions about pacifiers. My stance is, it's okay if the baby takes a pacifier. It can help the baby stay calm. It can teach good oral function, but that pacifier needs an exit strategy at about 6 months of age. So if your baby becomes addicted to that pacifier, it can create a lot of havoc in the development of the oral function, which can influence how your baby eats, how your baby breathes, how your baby talks, and all kinds of other oral function, including how your baby's palate is shaped and if your baby's going to end up needing braces. So what if your baby doesn't want to take a pacifier? Should you be concerned? Well, it depends. So what my experience is a lot of times when babies won't take a pacifier, there are some oral sensory issues going on, and the baby just does not want to have things in their mouth. So if your baby has that going on, it would be a really good idea to try to figure out why the baby doesn't like the pacifier. Is it a baby who just doesn't need to suck and that's okay? Or is your baby gagging, making funny faces, trying to spit things out of their mouth? If that is the situation, then it needs to be addressed further, in my opinion. You want to make sure that that baby is comfortable with touch in their mouth, because that's how they learn to move their tongue around, which helps them make speech sounds. It also helps them with oral development for feeding and swallowing. All of those things are super important. So what should you do if your baby won't take a pacifier? Well, my suggestion is to use this pacifier, and this is not always the most popular pacifier for babies, because if they don't have good tongue patterns and they don't suck correctly, this pacifier is going to fall out of their mouth and they're going to get mad and cry, and you may feel like they don't want that pacifier when in fact maybe they do want the pacifier. They just don't have the skills to be able to use that pacifier correctly. Now, all of the other pacifiers that have the skinny necks, I am not a fan on, because babies can just clamp onto it with their jaw and just flick around with their tongue. And if you are breastfeeding, that is a road for disaster. Whereas this pacifier can actually stimulate the patterns that are going to support breastfeeding and bottle feeding and speech development, because it's going to create the cupping, that central grooving, the pulling back of the tongue, the undulation, movement backwards for transport of the bolus, as well as for activation of the correct patterns for the tongue. So what you want to do is just be slow and easy, and you can put that pacifier or your finger near the baby's lips, and if they will open their lips, you just can gently rub that pacifier side to side on their lips, and as they open their lips more, you can go a little bit further to the back. Make sure you watch the baby's eyes, because they're going to tell you how comfortable they are with touch in their mouth. And if they're not comfortable with touch in their mouth and you're doing these little tiny exercises and baby gets mad, you need to stop and try it later. And if that happens time and time again, then it might be beneficial. I think it would be more than just might. It would be beneficial for you to get an evaluation from a speech pathologist. Sometimes it's an OT, but mostly speech pathologist that specializes in feeding and swallowing disorders in infants. And that way they can look at how your baby is using their tongue to make sure that it's optimal for development for speech and for development for feeding. So if your baby is not taking a pacifier, maybe not a big deal, but it could mean that they have some sensory issues, and those issues need to be addressed, or you're going to have difficulty with spoon feeding, with chewing. You will end up having a child that really only likes the junk food They will be little babies that don't want to eat vegetables, maybe even not fruits, definitely not meats, and they won't eat food off the table. And if you're a healthy eater, you want your kids to eat healthy, you definitely want them to have the correct oral function so that they are able to do that. So if your baby doesn't take a passy and they're very feisty about touch around and in their mouth, getting a therapy session or an evaluation so that the therapist can train and teach you the patterns that would be helpful for you to help your baby develop the correct patterns. I hope that's helpful. Don't get too worried, just get help. And the faster you, the worst case scenario is you spent some money and they said your baby is completely fine. And the worst case scenario is that you waited too long and you didn't get any help and your baby's having trouble. So please, proactively seek out some help if you need it. Please feel free to leave me a question or a comment and subscribe, and we'll talk to you soon. Thanks for your time.